So how does one think about opening this lockdown in a way medically so that you minimize this type of uncertainty so you don't have an accident with a second lockdown?
This is a 12 to 18 month problem. No matter what we do, we're not going to be out of the woods. We're not going to be through this problem by July or by November. This is going to be with us till 2021. And if everything goes very, very well and we have a vaccine and it's widely available, then sometime in 2021, life can begin to go back to normal. The reason it's important to communicate that is people need to understand the time frame and need to understand that lives are going to change over that time. Obviously, for people who are very poor, who are hourly wage workers, daily wage workers, the uncertainty is very, very costly. And so this is why it's extremely important to have a strategy. So as you open up, you can create confidence in people that you're not going to have a massive outbreak. And there's a set of policies you can take to reduce that. Now, to be perfectly honest, no one can guarantee that we will not have major outbreaks. Another lockdown won't be, but you can minimize that risk.
Is there a particular method to testing? Are there certain areas that we test? How do we think about testing as a strategy?
South Korea, Taiwan, Hong Kong, the East Asian countries have actually done a very, very good job of this. But certainly in Western Europe, United States, people are still trying to come up with what is the right testing strategy. My general approach on this has been, you have to have, so let's kind of talk in generic terms and then maybe customize it a little bit for India. So in generic terms, you should be testing anybody with any kind of symptoms. You won't pick up everyone because there are a lot of people without symptoms. We think, probably 20% of people have no symptoms throughout their entire disease, and another 20-25% of people spread the virus before they develop symptoms, but they will eventually develop symptoms. So you should be testing everybody with symptoms. And then you should have a strategy for surveillance of high-risk areas. And so you have to sort of think about what are high-risk areas, and that's where you really have to customize it. My feeling is anybody who gets admitted to a hospital for almost any reason in an area with any kind of an outbreak should be getting tested. Mostly because if you miss an asymptomatic person, let's say who comes in with a heart attack, or let's say comes in with a broken leg, but they're asymptomatic and spreading, they could spread it to 30 healthcare workers and 70 patients, and that would be a disaster, right? So you need a very aggressive testing strategy in high-risk areas like hospitals, like homes for elderly people, et cetera. And then, if you can, you want to be doing more community-level surveillance just to make sure that you're not missing undetected disease.
We have this cohort of people, young people, who are also very vulnerable.
We know that the biggest risk factor for having a bad outcome from getting very sick or dying is age. And that is one advantage that India has, that it is certainly compared to Western Europe, to America, to many other places, or even East Asia. India is a younger population, so that's good. One is we are finding more and more that even healthy young people, some percent of them end up getting very sick from this disease. And so we should not be too cavalier, even for otherwise what looks like healthy young people. Then if you get into your issue of people who have lung disease, who have heart disease, who have diabetes, high blood pressure, those people are really at increased risk. Maybe not quite as much as a 75-year-old or 80-year-old, but definitely at much higher risk. And a lot of those people end up getting very sick and dying. So we really have to, in my mind, try to protect all of those individuals, which of course ends up being quite a lot of people. And so this is why, there's some people who say, well, maybe in places like India, we just let herd immunity happen and let hundreds of millions of people get infected. I think that's a terrible idea. And the reason it's a terrible idea is it will lead to millions and millions of people dying, and including a lot of young people with these conditions. So we have to take a strategy that tries to protect everybody, but particularly older people and younger people with chronic disease. I got a BCG vaccine when I was a child, and many Indians have. And there is some circumstantial evidence that maybe BCG vaccines can be helpful in reducing severity of the disease. It is not very good evidence. It is not evidence I would bank on. I certainly wouldn't make policy based on that evidence. And look, it's a new virus. There's new testing, new studies going on. And in the next couple of months, we will know much more because there are some nice randomized trials that are happening now. So I suspect in the next 3 months, we'll know much more about whether these vaccines will play a major role. I am personally skeptical that the BCG vaccine will end up being an important mediator, but I don't know. We'll know. We'll know soon. There is some evidence, again, that weather makes a difference. And we think that being outside, there's less transmission than being inside. So the home with 15 people all staying in one small home, small room, there's going to be very easy transmission. But once people are outside and there's air and all of that, that'll make it a little bit better. But the question that I ask people who bring up the temperature issue is, do we think it's enough that it will keep the virus under control? And I think the answer, no one I know thinks it's enough. So maybe instead of the average person transmitting it to 3 people, it'll be 2.5. Maybe it's a 20% benefit. Good, I'll take it. It's not going to be enough to get us out of this.
You're saying that a joint family system with old people living inside it is actually a complexity and a risk.
You know, coming out of places like New York, where a lot of the people who got sick and died in New York were older people who weren't going out and working. But basically what we think is that the young people they were living with were going out and working, coming home, and then there was interfamily transmission. So it's a very big challenge when that happens. And in India, of course, 3 generations living together is a very, very common way of doing things. So there is a real challenge of how do you protect older people, especially as you open up and people start going back to work.
What we're seeing now is 1% of the epidemic. The real epidemic is going on. We don't notice it really.
It's a psychological reality, the lockdown, and an actual reality. So how do you come out of that? What is the gentlest way, the smartest way from a healthcare perspective to come out of that?
And that's a very good question. And I've been asking myself, all the countries in Europe that instituted the lockdown a month ago, 2 months ago, did they ever think about the exit strategy at that time? I don't think any single country said, we'll do this lockdown, we close the schools, we close the borders, we close the restaurants. I don't think at that point they thought about how do you get out of it?
Yeah.
And now everyone is asking the same question, how do we get out of this? It has to be stepwise, I think, that you take, of the restrictions you have in India, you take one away, you soften one restriction, you wait 2-3 weeks and see what happens. Do we have more spread of the disease? Yes, we had more spread. Okay, then we take one step back, reinstitute and try another restriction if that works. So I think it will take months to really ease out of all the lockdown, but you must do it one restriction at a time and see what happens. I think you will soon create more harm than good with a severe lockdown. That's my guess.
And that's from an economic perspective.
Economic and humanitarian, yes. And I think it's better skip the lockdown, take care of the old and the frail people, and let the other people have the infection. Most people will not even be sick. They will not even notice they have it. It's a mild disease. How are you talking about this balance between disease and economy?
I think the full lockdown is damaging, and the damage increases exponentially. So the sooner you get out of the lockdown, the better it is.
I mean, you may even create more deaths by a severe lockdown than the disease will do.
We have a lot of manual laborers who depend on daily wages. And they're already in trouble because they simply are not getting those wages. And so provision of food for them at scale is a challenge that the Indian government and state governments are facing.
Yeah. No, I think for you in the situation that India is and with the federal states and everything, I think you should have a very soft lockdown, as soft as possible.